Yes, actually, my story starts with somebody from MIT way back, a professor here who went on to win the MacArthur Prize and a whole variety of other things, came to me and he said, look, I had to stop running the marathon, training for the marathon. He was one of the early marathoners because he hurt his ankle and then his knee. And he came and he said, look, I have adult onset attention deficit disorder. He said, I've never had a problem with attention because I've always been running. And that's what stimulated me to get more into attention with my patients. And Ned was, Hallowell was my, I was chief resident, he was resident, so we began to work together, and that's how we went to ADD for 15 years or so. And then I came back to the whole idea about exercise and its effect on the brain. And I bring my dog, who's a Jack Russell, and when I got this dog, I took him to the vet. The vet said, you got to put him on Ritalin. That's my website, and on Facebook, that's me. And then I'm happy to be partially funded by Reebok. I was funded before by Johnson & Johnson, which lets me go around to do things like this. It's wonderful. Anyway, so my understanding, I think our understanding in neuroscience is that we need to move. We are born movers. It's only 10,000 years ago that we were hunter-gatherers, and we moved anywhere from 10 to 14 miles a day, foraging, moving from place to place, running, climbing, swimming. No one was training for triathlons or marathons. Everybody was fit or you died. So what we know and what happened over 500,000 years that we were hunter-gatherers is that our brains grew. And our brains grew from the motor cortex, the red area there, out, up front. Our frontal cortex got added on piece by piece over those 500,000 years. And we essentially added on those pieces to help us be the best movers, to think and to plan and to predict and to do all those lovely things that we humans evolved to do. But those same nerve cells we use and are stimulated when we move. So that's one of the key concepts. And a very hard-edged scientist down at NYU, Rodolfo Linnaeus, said that in a great book, that's which we call thinking is really evolutionary internalization of movement. Meaning, if we didn't move, we wouldn't be thinkers. If we weren't the queens and kings of movement, we wouldn't be the kinds of thinkers and have an MIT Media Lab. Now, if you read the New York Times, you see these warnings all the time. Don't sit. Sitting is the new smoking, okay? And that's a neat phrase that encapsulates it. And everybody's talking about this and studying it, seeing how much mortality, morbidity is increased as we sit. Well, then we have what we know from studies that when we stand, our brains are a little bit better, maybe 7% better than we are when we're sitting. So that's why, as a lecturer, it's very hard to sit and lecture from, or even with me, I have to move around, so that keeps me focused. And what it does is because we're using muscles to stand, we're using the large skeletal muscles, the core muscles, all that, it feeds back to the brain, switches the brain on, which feeds forward to the prefrontal cortex, which is where we generate our thoughts and this talk and where we learn, as well as perform. Now we're getting more and more data, more and more laboratories are picking up on the effect of movement on the brain. Its watershed event was in 1995 when coming from worrying about the growing problem down the road with us boomers of Alzheimer's disease and cognitive decline. There was a big MacArthur study, countries looking at what were the things that prevented the onset of cognitive decline and aging. Well, there are three. One was optimal weight. Two was continuous learning. Three was exercise. Now, even when they factored out the effect on the cardiovascular system, the prevention of stroke, exercise was really the most robust prevention for cognitive decline and Alzheimer's disease. So this started a whole series of reports that really was flowering right in the midst of when neuroscience was beginning to really take off. And so we have, before then, I would have, in scanning the Medline, there would be 10 to 14 new papers a month. Now I'm sent 40 to 60 new abstracts every week from the Laboratory of Medicine. So everyone's interested in it now because we know that a major effector on our brain, in fact, probably the most effective thing that we can do, because when we evolved all those brain cells. And when we move, we fire those brain cells. And now we look at our brain as not we look at it as a muscle. So the more we use it, the better it is, the better it grows. So when we exercise, we're using those nerve cells that we use to think and learn and all of that. Now, this past year, there have been a lot of good events about exercise. Finally, the American Psychiatric Association said that exercise is, in fact, a treatment for depression, even though we've known this back with Hippocrates. The Institute of Medicine has said, did a large study and said, look, physical education, fitness-based physical education should be a core subject for all of our kids, not because it makes them healthy, but it improves test scores. And the data is there, and they came to that conclusion. The head of the CDC said that exercise is the best medicine for most everything. The cancer people now are using exercise as a treatment for improving our killer cells, improving the effects of medicines. And I zeroed in on this topic back when I heard about this school in Naperville, Illinois, school district, 19,000 kids. They were on Super Size Me, the movie. They interviewed the real revolutionary physical educator who had changed the PE program in Naperville to a fitness-based one. They had the kids every day. They had been the traditional PE, but he felt that the kids were still not fit. They were still overweight, getting depressed, all the things that he wanted to change in effect. So he made a big switch and change in the physical education program, and he got kids moving, all the kids moving. He had them every day for 40 minutes in a junior high school. He convinced the other teachers. Everyone started to move. They threw the balls out. So they did running games, they did calisthenics, and a couple years into it, he realized he was still giving the athletes the best grades. So he said, wearable measurement. So he was the first one to use heart rate monitors in gym class, and you got your grade by being in your cardiac training zone. The reason why it was in Super Size Me, the movie, which was all about our obesity crisis here, is that in 2003, of 19,000 kids, 3% of them were overweight. 3% overweight. They looked at 7,500 kids in the high school, not one was obese. Not one. And the average then was 33% of our kids being overweight. Now it's 37%. So something was happening, and this was a big part of it, was this daily fitness-based exercise. Cut to, 2 years before they did these measures, 99% of the kids took the International Science and Math test, the TIMSS test. You can do that as a country. We take it every 3 years. all countries in the world, and we rate, and usually the U.S. is in the teens in math. So not only were they fit, these kids were with it and smart. So that got me on an airplane to go out and see what was going on. Now, we had known about the power of exercise in my field, in psychiatry, for a long time. Hippocrates wrote about it 300 years BC. However, it was never science. It was never proven. And then in the late 70s, early 80s, Duke University Medical School was very interested in exercise as a treatment for cardiac problems. So they were getting all these post-MI and angina patients to exercise on treadmills. And the psychologists were seeing if they could change them from type A to type B. What they found was remarkable, that not only were they less aggressive, less anxious, less stressed, but their mood was better. They were less depressed. So they began then a love affair with exercise and depression, anxiety, aggression in the Department of Psychology, and they were falling right along. And then did a whole series of studies throughout the 80s and 90s, and this paper, the data from this paper, and just these are cue cards for me. So, but the data showed they took 100 people who came into Duke over a 4-year period of time, wanting treatment for depression. They put a third of those patients on Zoloft, an increasing doses of Zoloft. They put another third on an exercise regimen, and they put the final third on both. And what they found after 4 weeks is that all their depression scores dropped to the same level. They became undepressed. 4 weeks, and at the end of 4 months, which was the level, the time of the study, it held. So that this was a treatment. Well, this was barely big news because here was the first time we've had really scientific validity comparing it to a drug, saying, look, this is as good as a medication. All the people, those 100 people coming in were sedentary. They hadn't been movers at all. So it was really changing the way their life was being led. And it really had a big impact for about 3 days. You know, it was on the news, it was in Newsweek, Jane Brody wrote about it, but we forgot. Most of the people in my profession never heard of it. So psychiatrists who head up depression groups, now they're hearing about it. So we've known this, and this happened in 1999, and they were criticized because they didn't have a placebo group, so 10 years later, they did another bigger study with a placebo group in it, so randomized, controlled, all that stuff that we have to do, and found the same effect, that it was as good as our antidepressants. Also, we know that it has an effect on anxiety and stress, that the more fit you are, the more stress it takes to get you stressed, to turn on that sympathetic nervous system, and then the fight or flight syndrome. And now we know, we're learning why. We know we change the dynamics of the arousal centers in the midbrain. When we exercise, we change the dynamics of norepinephrine, which starts the whole process. But we also have an effect in the hippocampus, which is a big center for our work in exercise. The hippocampus is the memory center for the brain, sort of grand central station. But it also, and we've learned in the past 10, 15 years, that it's also a controller of anxiety and panic. This is where most of the binding sites for cortisol are, in the hippocampus. So when we are stressed, we can learn quicker for a while until we burn out, and that's what happens. If you're chronically stressed, you begin to erode nerve cells. Well, it's also the area of the brain that we have this wonderful evolutionary process called neurogenesis that occurs. Neurogenesis, which we discovered happened in humans in 1999. We didn't know that happened before. It was hard for a lot of people to grok it, to understand it. But we, in fact, grow new nerve cells all the time. That's what neurogenesis is. And we have stem cells, and we grow them into this memory area of the brain every day. And activities such as learning, meditation, enjoying, laughing, being with someone, increase the amount of new stem cells that we change into new nerve cells. But nothing does it like exercise. Elizabeth Gould from Princeton, this year, her group looked at what were these new brain cells? What kind of new brain cells were we growing? So they looked at rats, as we always do, and found that the fit rats grew more of these cells that contain GABA, which is the brain's major inhibitor. So it puts the brakes on the excitatory nerve cells that might be responding to stress or a threat or something that it takes more of a threat to turn on our defensive system and our sympathetic nervous system because we have more GABA cells in our hippocampus. Interesting. Now, as I say, one of my whole work, life has sort of been wrapped up in understand the brain and how we can affect it, and we can affect it with exercise, or we can use our ample drugs that we have, and we have many of them. A lot of them are Me Too drugs. There hasn't been a really new breakthrough for a long time that affect the brain, but exercise does the same kind of thing that many of our medicines do. I've always said that a bout of exercise is like taking a little bit of Prozac and a little bit of Ritalin, because it does the same thing. It increases our neurotransmitters, and the three that we in psychiatry have been addicted to are dopamine, norepinephrine, and serotonin. Well, immediately exercise increases the concentration of these neurotransmitters. So it's like getting a bit of psychopharmacology there. So all these drugs and these neurotransmitters modulate many and a lot of our important human systems, brain systems: attention, aggression, motivation, concentration, alertness. And with exercise, you can change the level of concentration of these neurotransmitters. And back in '95, the big study that showed that rats, when you had mice running and then rats, that you grew thicker brains, you grew thicker cortexes, and he also discovered that your hippocampuses were bigger. Well, we had learned about this substance BDNF, brain-derived neurotropic factor, some years before, and we thought of it as a helpful fertilizer for the brain. Well, in the mice whose brains grew because of exercising versus those that didn't exercise, not only were they smarter, their IQ, their SAT scores went up 20%, and from 7 days to 4 weeks of exercising daily. But their brains were thicker, better, bigger, and so this led to this revolution that we see around us. And BDNF does a lot of things in the brain, helps our brain cells survive, trains it to our cells to migrate appropriately at birth and throughout, helps with plasticity, and that is the basis of our learning, is our brain cells have to grow. And the BDNF and other factors support the growth of our brain cells right at the tip, making us have more receptors on the postsynaptic side, and presynaptically increase the amount of neurotransmitters that we have there by firing away. So it's an important element, and it's become important in psychiatry, actually from 2002 on, when we began to look at depression as the brain shutting down and actually eroding. And so BDNF became an important measurement, and something that the biotech companies said, oh, we got to learn how to make more BDNF and then we'll make a lot of money. Well, they never really were able to do that in any kind of useful way, but and all the medicines that we have that treat depression affect BDNF positively. We increase our BDNF levels. So it became the signal factor to look and see whether the drug was going to be an antidepressant if it increased our BDNF. Well, nothing increases our BDNF like exercise does. It trumps everything, all the drugs, learning, meditation, everything else. Exercise increases our BDNF because just in the past 2 years, actually somebody from MIT showed that we make more BDNF when we fire our brain cell. There's a feedback loop that goes back to turn on the genes to make more BDNF, which then is self-fertilizing. So, and the point being is that when you're exercising, you're using more brain cells than in any other activity. You're using a bigger swatch of those 100 billion nerve cells, firing them away to act, and that feeds back into more fertilizer. We also learned about increasing our levels of the endorphins, and most people have heard of that, certainly connected to the marathon runners who can, they can run up Heartbreak Hill because they're in this nirvana state, because we thought that just because they were releasing all these endorphins, because we could measure this back in the 80s, and it's true. We do increase our endorphin levels, but we also lately have featured and focused on another substance that we didn't know much about back then called the endocannabinoids. Most people know what cannabis is. Well, it was a big deal in neuroscience when we realized that we make our own marijuana receptors, and we have 2 or 3 marijuana-type neurotransmitters or neurohormones that are released when we injure our body and our parts of our body and have an effect not only at the body level but in our brains. And that's one of the areas that has been so interesting to me, that our body has, by exercising our body, by weight training, by movement of all sorts, we have a feedback loop up to our brain and guide the brain. We have all these factors that are produced when we exercise in our bodies that travel up to the brain to have an effect. And there's an interesting factor in the heart called Atrial Natriuretic protein, ANP, that is made when our atriums beat faster. And this goes to make our cardiovascular system better, but it also goes up to the brain, to the hypothalamus, to turn down central command of our the fight or flight syndrome, or turn down the effect of the rapid heartbeat. So studies have been done in Germany where they blocked ANP from getting into the brain, and 100% of people who have this blocked develop a panic episode. And so this is an anti-panic kind of drug, or if you will, or a factor, that when we exercise, we are producing more of this stuff as our heart beats faster, and it will have another effect on slowing down our sympathetic nervous system, or the anxiety and panic. Now we know what happens in the periphery. When we exercise, we tear muscle fibers, and the next phase of that is recovery and repair. And we send out all these factors to help repair our muscles, IGF, to bring in more insulin receptors, to feed the area that's wounded, FGF2 to make more muscle fibers, VEGF to make more capillaries to bring in more blood supply, other cytokines that turn on the inflammation system or tune it down or bring in the killer cells. And then we have the endorphins and endocannabinoids that are made right at the spot of our muscle damage. And we all damage our muscle when we use them. It's inevitable. And so we're always creating these substances that have a direct effect on the body for repair, but also have an effect at the brain to turn the brain cells on, to help actually cement our learning. A number of them go up to do that, and a number we have to activate them from the periphery to turn on our stem cells to develop into new brain cells. Now, there have been many studies that looked at exercise and its effect on cognition, and especially preventing Alzheimer's disease. And the Mayo Clinic reviewed over 1,600 papers last 2 years ago now, all showing a positive sense of exercise preventing the onset of cognitive decline and Alzheimer's disease. Very big watershed study came out of there because in neuroscience, a big push was to say, okay, let's really prove that exercise was a useful thing to do to prevent the onset of Alzheimer's disease. So many groups have looked at this. This one very important study at the University of Illinois took 100 69-year-olds and divided them into two. One group, they were all sedentary. One group, they began exercising. The other group, they did stretching and toning, but they weren't getting their heart rates up. The other group, they got their heart rates up to about 75% maximum and lasted for about 30 to 40 minutes, 4 times a week. And what happened after 6 months is they looked at their MRIs and found that those who were exercising, those areas that are blue and yellow there, those are areas of brain growth in the 69-year-olds. Their brains actually grew. So they didn't erode, they grew. And by the way, they did 11% better on their SAT scores after exercising for 6 months. Now, one of the slides I love to show audiences is that evolution has built in our ability to change, and to change at any time, if we go for it. Ernestine Shepard on our left up here, at the age of 56, had been obese all of her life and was a couch potato. She decided she's going to get fit. She started to run. She started to go to the gym. There she is at the age of 74. Mr. Singh, some of you might have heard of because he was on ESPN. Mr. Singh had never exercised. At the age of 80, his wife died. At the age of 81, his son died. He got depressed. He went to the doctor. He said, start running. So he took him up on that. There he is at the age of 100, finishing the Toronto Marathon. He retired last year, finishing the Hong Kong Marathon at the age of 101. And I have this vision of him being like Forrest Gump saying, I'm tired. I'm not doing it anymore. But you can do it. And the point being is that you can switch on the machinery, the epigenetic forces to change your body, your brain, your abilities to exercise, to do it. So there's really no excuse. Now, one of the areas that is very important to me, and one of the reasons that I'm here and go all over, is that I've been trying to get exercise back in our schools. And because you know what's happened, everybody's teaching the tests. It's all about the test scores. It's all about, what I call no child helped at all, and race to the top. And, so they're cutting away recess, they're cutting away PE, as well as music and art, but they've certainly cut away PE. And so what we're trying to show is that that PE fitness-based physical education is really a way to improve test scores, because no one cares that it makes the kids healthier or less depressed. There's no measurement for that yet. But they do care about test scores. So this is one of these groups, again at the University of Illinois, looked at 20 kids. I think they were in 6th grade, just sitting. That's the slide on your left, and that's a QEEG, which is just a measure of brain activity. The colors mean more brain activity. So they were just sitting there, and so their brains were that kind of active. They did an hour walk, or I'm sorry, a 20-minute walk. They came back, got situated, retested their EEGs, found that they had all this activity in their brain. The brains were turned on, which is what we see and what we think and what we know. A way I talk about exercise and its effect on cognition is that it affects our brains in 3 ways. The first is it helps with our brain systems that I talked about before, our attention system especially, memory system, motivation system. As well, it works right at the cellular level to create the right soup for our nerve cells that swim in to be most likely to grow and change. And that's what we want to do if we're going to log in any kind of information. And third, it promotes neurogenesis like nothing else, which is new cell growth. Now, I mentioned Jack, and I thought I'd bring him back. As I say, I had him running every day to treat his ADD. After a good run, he would come in and have what I call the Jack effect. He could take notes from me because they're also very smart dogs. However, there are times when there's no recess and he goes back to his old ADD ways. And by the way, whenever I give a lecture, everybody wants this slide. But anyway, so, and that's what we see. And now studies have shown that exercise is a good way to treat ADD with or without medicine. So your attention system is turned on, you're more focused, you're more able to withstand frustration, you're more able to power through the problem at hand and not get so frustrated. We've known this. We've known that the more fit you are, the better student you are for a long time. This is a slide from 2001, I believe, 2002, from California, where they've been testing kids. They've been evaluating their levels of fitness, 1 million kids a year since 2001. And they see graphs like this every single year in grades 5, 7, and 9. That is, the more fitness standards you meet in this thing, a fitnessgram, the higher your test scores in both math and English. And this has been repeated now every year. This is what they see. So we know this happens. Ken Cooper, who came up with the word aerobics about 41 years ago now, got together the money to do a big study in Texas where they looked at 2.6 million kids in 1 year, evaluated their fitness scores, and looked at all kinds of other parameters. They looked at their test scores, they looked at their grades, they looked at their truancy, they looked at their attendance, they looked at aggression and impulsivity. And they found a direct correlation with increasing test scores, increasing grades, increasing attendance at school, decreasing and direct correlation, decreasing with outbursts and impulsivity in the classroom, the more fit the person was. The higher their test scores, the better student they were, and the less disruptive they were. And so what was important about his study is that he looked also at demographics, and there was no difference, sexual, gender, ethnic, racial, SES of your parents, and even the school you went to. So the more fit you were, the better student you were. Now this study sort of cinched it for us in this area. It came out of Sweden a couple years ago now, where the epidemiologists looked at 1.2 million boys in Sweden, who all of them had been evaluated at age 15, levels of their aerobic fitness and strength and all those other kind of measures, as well as their IQ and their cognitive performance on tests. The boys were retested at the age of 18 because they entered compulsory military service, did the same tests. What they found is that if your aerobic fitness improved in your high school years, so did your IQs, so did your cognitive performance on tests. And this held even with 650 sets of identical twins. So if one twin improved cardiovascularly, their IQs were higher than their non-exercising other twin, or their, so that it really led to a lot of changes. And if you look at the science and you pay attention to it, that we know that exercise improves our ability to think and perform, as well as having an effect on regulating our stress levels and our mood and all the things that I worry about as a psychiatrist. And there we are at Harvard. We started a project called Harvard on the Move. There's the president and Dan Lieberman and Chris McDougall and myself. And it's been going on now for 3 years. It's a daily movement activity of all Harvard students, or as many as we can get, running, walking, moving during lunch or in the mornings. And it still continues. It's actually funded. So that's why it continues. Who really listens to this are these movers and shakers from Taiwan. In the bottom panel here is my meeting President Ma of Taiwan, who had read the book and said, "I'm bringing you over." So I became sort of a rock star in Taiwan. President Ma graduated from Harvard Law School and also was a triathlete. So when he read the book, he said, we're making a sports island out of Taiwan. And so he began to immediately increase the occurrence of PE from twice a week to 3 times a week in all the schools. Just went, boop, I'm doing this. One of the advantages of a centralized government. There are many disadvantages. Then a panel above it is me meeting with the Minister of Education, Science and Technology in South Korea, who also had read the book and changed the school system. He increased the school time by an hour per day, half of it devoted to returning physical education and sport, half of it to math, music and art. It had been weeded out of the South Korean curriculum over the years because everybody was interested in test scores, test scores, test scores. They were worried more also about the increasing level of suicide amongst, they lead the world in adolescent suicide. So they were trying to kill 2 birds with 1 stone, as it were, keep the test scores up there, make the kids less stressed. And there I am with Dr. Kao from Japan, who was an assistant deputy of education, who also engineered some changes in the curriculum for all Japanese students, increasing the amount of exercise they had in their week. There's a new book that's coming out in June, which is what you're all hearing about here, wellness, and we call it Go Wild. And looking at diet, exercise, play, sleep, nature, mindfulness, and the connection in small groups. Now, some things to do for you all. This is a paper that was in the Harvard Business Review in 2008, this cartoon. It's about the boardroom meeting room of the future, which was sort of seemingly something out of this world. But I presented this part of the talk out at Google University some years ago, and afterwards one of the Googlers came up and said, you know, that's the way our boardroom has looked from the beginning. So, and I know some of you have probably toyed with the idea of having these treadmills with a desk on top, you know, the tread desks, and they have them in a lot of places in Silicon Valley. Also, now the standing desks, because it has come into the schools, but has also come into a lot of businesses to just get off of our duffs, because we think better, we do better, we pay more attention. This is a bunch of schools in Minnesota started it some years ago now, tested it, found that the kids had better attention, had better retention, had better performance, did better, felt better. It wasn't about wellness per se, but they were better students. Then there's all these things that are happening around the country. And one of them is something called the fit desk. Those people in the back are on a fit desk versus the kids in the standard chairs. And the kids that were on the fit desk, which is a really elaborate and stable bicycle underneath your desk, they did better than the kids in just regular seating. So it's something, again, to think about. They're fairly inexpensive. Then there's the exercise balls sitting on them, improving attention. It was started by a teacher for ADD kids out in Palo Alto a long time ago now, brought in her exercise ball, had her kids sit on it, and found that they could pay attention better, they could do better. And now a number of colleges have looked at it and see that those kids sitting on the exercise ball in a class do better than those kids who don't. One other helpful app that I will recommend to you is something called the 7-minute exercise. You can get it, it's free, downloadable. It's developed in Orlando at the Human Performance Laboratory. And it's a fun 7 minutes of exercise to get you going. When you need to take a break, when you need to clear your mind, this will do it. So it's something you can all use. So we have some time, I think, for questions. So are there any? Yes.
Otherwise, we don't have Hello? Yes. So I'm curious, when you say exercise, do you mean getting your heart rate up, or is it also okay to go for a walk, or?
Well, when you go for a walk, you'll get your heart rate up. There's no question about that. You will get your heart rate up, but it really depends on heart rate. That's what exercise means, getting your heart rate, pushing it. 75% of your maximum, 75 to 85% is where most people who are exercising, truly exercising, live. And that's where all the studies that I have talked about in terms of depression, anxiety, but also in terms of improving our ability to take in information and perform on a test.
Is there an optimal amount of time that you'd want to exercise? And then is there an optimal
Well, it's always a question of, usually people ask that because they think, what's the shortest time I can exercise?
Exactly.
And it's true. It's duration versus intensity. So the more intense, and that's the big thing if you follow exercise these days, is high intensity interval training. there was just another article in the New York Times last week about high-intensity interval training, that you get a bang for your buck if you just do 30 seconds of maximal heart rate for 30 seconds. You change a lot of your hormones around and a lot of your neurotransmitters. And actually the cardiologists are the ones who are doing this now and seeing that this has as much effect as you spending 30 minutes on the treadmill every day. So just by switching around and having those sprints and getting your heart rate way up, and that's what. Have you all heard of Tabata, Dr. Tabata from Japan? These 4-minute exercises. I usually put the audience through that when I have a lot of time, but it's really was developed for the Olympic team, but it's very popular, and it will get you going. It's 30 seconds and 10 seconds rest, 30 seconds and 10 seconds rest, and you go as fast as you can. Whatever it is, can be weights, can be push-ups, can be squats, can be jumping jacks, can be running in place. But you do 6 sets of 30 minutes. Oh, 30 seconds, sorry.
So that's the extreme for a short amount of time.
Yes.
And then there's what we were all sort of taught, the 30 minutes or 40 minutes of,
Yes.
75%. What about I heard something about this too, if you could just do, a good vigorous brisk walk or something for 10 minutes, 3 times a day or something, can that kind of equal the 3?
The 30 minutes, yes. No, that's been studied. We looked at people putting together 3 10-minute blocks. They have the same effect as a 30-minute block of getting your heart rate up for things like depression, anxiety, and cognition. So the important ones are affected, and it doesn't matter whether you split it up or not. So you're walking up the stairs rather than taking the elevator is a way to break up your day and a way to make your brain better and to sort of get a jag from using your body better. Yes.
Stand up for this question. So I'm a pianist, and playing the piano, can you hear? So I'm a pianist, and playing the piano is actually an incredibly intellectually taxing activity because you often have to juggle like multiple melodies in your head, and especially when you're improvising, you have to like think on the fly. And playing the piano is a sitting activity, but there's a huge difference between kind of just like sitting back like in a normal desk and sitting on the piano where your abs and back are engaged and you're kind of moving around like that. So it kind of goes with your point of sitting on exercise balls is good. But the other point I wanted to bring up is that in addition to just like basic sitting correctly on the piano, the thing that really makes your mind go more quickly when you're playing music is actually engaging in a rhythm that takes your whole body. And I was wondering whether some of the positive effects of taking a walk could perhaps also be attributed to the fact that walking is very rhythmic and it kind of gets your body in a rhythm.
I'm sure rhythm plays a big role. The longest living profession are conductors of symphony orchestras. Because what do they come out to practice every day? What do they walk out on stage with their baton and a towel? Because they're jumping around. They're in high aerobic state all the time. Plus, they're thinking like you think when you're playing the piano all the time. They're having to remember and move and get their orchestra in control. So they have the lowest incidence of cognitive decline and Alzheimer's disease. They live longer because they're happily engaged for sure, and they're moving all the time. A friend of mine started a whole process called conductor size to get people conducting, just playing, yes, just jumping around like he does, and especially in the nursing homes but also in the schools to get people moving again.
And I guess just a little tiny nugget. And I wonder if, so the way that we're thinking about it now is that we're living like really sedentary intellectual lives, and then we're like compartmentalizing another part of our life devoted to like very, very physical activities. I wonder if perhaps the benefits could be amplified if at all times we're not only intellectually but also physically and perhaps even emotionally engaged, and it's trying to combine multiple aspects for as much.
I think that's what this entire course is about in well-being, is to really get optimal engagement. And you're right. I do think. I mean, we know from studies that you can raise your heart rate, but if at the same time you have coordination challenges or thinking challenges, you do better. You do better because you're using more brain cells more intensely. So, and we've done studies to show that. Okay, we have. I mean, that's for sure. So, really, one of the best exercises you can do is dance, because it demands so much. I mean, aerobic activity and thoughtfulness and getting the dance steps right. Then you add a partner in. That's complicated even more. So your brain is really on fire with the dance, and then you get into the rhythm, and you're really using so much of your brain and stressing it. And that helps it grow and stay with you. Question? Yes. Yes. Okay, she had a question.
How do you explain the fact that athletes are generally not the smartest people in school?
Well, here's the thing about that. I always say, just think how the dumb jocks would really be if they didn't exercise. The issue about that is that they don't care. A lot of the high-level athletes, you know, in basketball and football, you know, they're going on to the college, you know, and March Madness is coming and all that, you know, that they're not as interested in learning. That's not in front of them. They don't care about it. Now, the other side of that is many people who are really bright and are really committed to learning had a horrible experience in physical education. It was a time of shame and humiliation. And that's why that's why it's hard to get school boards to change their mind. You know, it's because these people have been wounded by their experience in physical education because they were nerdy or they were discoordinated or whatever it was, and they couldn't do it. So they were, you know, felt horrible, and so they have bad memories about physical education because it was just about who was the best and all that kind of stuff, and they weren't, and they remember. Yes.
Yeah, I'm thinking about, is this on? I'm thinking about tools that would compel that kind of activity, and all the antagonists in our lives to tools that are antagonists to that, like you know, computer work with a mouse and a keyboard. And when I think about, for instance, video games and watching kids, for instance, on video games, they find the least activity, the least movement that will get the result in the game. So, you know, how can there be ways to push people towards this if, you know, if just knowing about it, and, you know, we're lucky to be here to hear your lecture, but there are, you know, huge populations of people stuck in sedentary lives
right.
who can't be compelled.
No, you have to change it from bottom up and top down. There's no question about it. Unless you live in a centralized government, you know, the guy can say, okay, we're going to change, you know, we're going to do this. It's going to be different. No, but we actually use video games to increase activity, not the sedentary video games, but things like Dance Dance Revolution and the Wii Fitness, and the Xbox has its own version of a fitness trainer. So it can get kids moving, but they don't play those video games. It's usually the war games or, you know, WOW or something like that. Yes.
Last question, because we're running out of time, and John has a plane to catch.
Oh, I just want to say that I'm a little disappointed that I'm only kind of hearing about this today for the first time. And you've written books, and so have you ever gone to Michelle Obama and said, "Hey, you're talking all the time about exercise."
She has about
and-
5 of my books. Yes, I've been there and said these things. And I thought when Obama first won, because everybody in the White House was a big exerciser at that point when in his first term. Anyway, I don't know about now, but I knew both he and Michelle were big exercisers, and I thought this was going to be an easy thing to push through. But there are 50,000 school boards in our country. And the Department of Education may wish to change things, but you have to change things 50,000 times. So and you get this resistance all the time because teachers think it's about seat time, drill, baby, drill. And that's the way we'll improve education and not by adding fitness-based physical education back to our schools, and that is my mission, is to get people moving for the schools, but also for wellness. I mean, there isn't any better medicine than exercise. Now, you'll be weller if you add exercise into. You'll sleep better. You'll go into slow wave sleep quicker. But so it's something that both things. Wellness is a multifaceted issue, and you have to pay attention to all of them. But anyway, thank you all for attending and being so good.
Thank you very much, John. Maybe we'll disable the elevators in the building or something to for all of those people that weren't here today. So for those of you that are in the class, that are registered for the class, we'll meet in 244 in a couple of minutes. So, and everybody else, thanks for coming.